My name is Osama Hamdy, and I'm the medical director of the Obesity Clinical Program and International Medical Affairs of Joslin Diabetes Center and associate professor of medicine at Harvard Medical School. It's my pleasure and honor to be with you in the DAR symposium. And my topic is very interesting, I believe, for a lot of you. We know now about intermittent fasting, so we will discuss intermittent fasting and Ramadan fasting and what are the similarities and the differences. So let me start by telling you that fasting had evolved over time from the time that people were not eating enough because of the human necessity, lack of hunting and scarce of food, to become a religious and culture behavior along the history. And then more recently, it became a human choice. So we moved significantly in that way. So religious fasting is like Ramadan fasting, and the human choice is now is like intermittent fasting. And in any way, fasting will be considered as caloric restriction. So let me just go through some definitions so we will understand exactly when we are talking about any type of caloric restriction, what that means. First, caloric restriction is to cut caloric intake lower than 70% or sometimes lower than 75%. Protein restriction is when people restrict protein or certain types of protein like animal protein or restrict certain amino acids. Intermittent fasting is basically alternation between fasting and eating, but no more than 2 days. So there is no 2 consecutive days of fasting. So there will be some space between them. And then periodic fasting is a prolonged period of fasting, more than 2 days. So it could be 3 days, it can be 5 days, or sometimes even more. So if you look to the trend, for example, in the United States now about popular diet plan, you will know that low carb had been very popular, ketogenic diet popular, but the most interesting now is that intermittent fasting became the most popular intervention that people by choice select, and nearly around 10% of the US population are practicing some kind of intermittent fasting right now. So let us go to a more molecular level. What is the cellular mechanism of fasting? So basically, when you are fasting, you are downregulating what is called nutrient sensing pathway. So nutrient sensing pathway, every time that you eat, you are stimulating 3 pathways: amino acid pathway, protein pathway, and glucose pathway. Now, in the presence of adequate nutrients, what will happen? Usually that nutrient pathway, nutrient sensing pathway is stimulated, and the end result is that the cell in the body grow up, replicate, but also aging mechanism is activated. And the reason that aging mechanism is activated is that dysfunctional cells in the body are surviving by all those nutrients that you provide, which means that every time you are eating, you are actually reducing your aging and speeding the aging process itself, which is very important. Now, in a state of dietary restriction, that nutrient sensing pathway is now down-regulated, which put more stress and evoke some resistance mechanism among cells in the body. So what happens in fasting? In fasting, there is a mechanism called autophagy. So what is autophagy? Once you are down-regulating the nutrient sensing pathway, and once you are putting your body under stress, what the body will do, it will start to get rid of some of the worn components of the cell, including the mitochondria, which is a major part in the cell. So basically, you are getting rid of dysfunctional cells, bad cells, cells that are not performing very well. And this will give more chance for rejuvenation and formation of newer cells. And that occurs when you prolong the fasting even more. Yoshinori Osomi, who discovered the mechanism of autophagy, actually won the Nobel Prize in 2016. And basically what he's saying that if you prolong period of fasting, you can induce autophagy and then rejuvenation of the cells. So this mechanism is very important because as you age, autophagy mechanism is slowing down. And you need to stimulate that autophagy mechanism by putting the body under more stress of fasting and suppression of the nutrient sensing pathway. So in that way, people can have healthy aging, and this is very important, and have a much better aging process. Now, the impact is huge. Impact on age. This is what's called the lengthening of lifespan, which adding years to age, and lengthening of health span, adding years in good health, which are very important, I believe, for all of us. But in general, caloric restriction has many benefits, and those benefits are of no doubt had been seen for a very long time. Benefits in people with metabolic syndrome, people with type 2 diabetes, benefits on obesity, benefits on cardiovascular disease, fatty liver disease, and even cancer. And you'll be surprised that now there is a big trend in the US, and I think the FDA will approve some kind of prolonged fasting as kind of as a form of treatment of some types of cancer. So dietary restriction should be considered in every physician toolbox and can be offered for people as a strategy to improve health. So now let us move to intermittent fasting. And we will evaluate if intermittent fasting is the way to do caloric restriction or just to go by general caloric restriction, and what is the benefit and what is drawbacks. So there are three major patterns of intermittent fasting. The first pattern is what's called time-restricted eating. Basically, you are eating during a window and you are fasting during another window. Could be 12 hours of fasting and 12 hours of eating, or it can be 18 hours of fasting and 8 hours of eating, similar to what we do in Ramadan. So basically, Ramadan fasting is time-restricted eating, except for we are also restricting fluids. Time-restricted eating doesn't mean by virtue that you have to restrict fluids. The other way of intermittent fasting is what's called alternative day fasting, EDF, alternative day fasting. So one day you will fast, you will eat only 25% of the calories that your body usually consume. On the other day, you can go up to 125% of the calories. So day on and day off, day on and day off. This is called alternative day fasting. And then you have another type of fasting, which is called 5-2. So basically, 2 non-consecutive days of fasting, again, 25% only of the calories. And then the other 5 days, you would eat a normal 100%, or maybe even you can increase. Some people can do it 5-2, like what a lot of people are doing through Monday, Thursday of every week. But again, you have to restrict on the fasting days to 25% of the calories. And some people do it 3-4, so 3 days of fasting and 4 days of eating. So in general, what is the benefit? So before we go in a lot of details, any type of intermittent fasting will reduce body weight. And especially you will see it more in alternative day fasting and in 5-2 days fasting. You still see it in time-restricted eating, but not at the same extent. In the time-restricted eating, you get additional benefit. Fat mass goes down, blood pressure goes down. In the alternative day fasting, you will see also improvement not only in body fat and fat mass, but a lot of improvement in lipid profile. LDL goes down, triglyceride goes down. 5-2 fasting, although it doesn't reduce fat mass or lipid profile, but it improves insulin sensitivity to a great extent. You will see insulin start to go down. So there is actually big difference in the impact of every type of this fasting. So now let us move to clinical trials on intermittent fasting. So the first, and I would like to start with this one because this is what's called umbrella meta-analysis or umbrella review. So basically you take not only you do meta-analysis, but you take a number of meta-analysis. So here is around 11 meta-analyses that had been done in many clinical trials, randomized clinical trials, 130 clinical trials with a total of 6,883 patients or individuals had been on those trials. And the whole idea here is with every kind of intermittent fasting, time restricted, alternative day, 5-2, what is the impact on health outcomes and how we can grade those evidence. If those evidence are strong enough to make a claim that intermittent fasting is valuable. So those studies are done in people who did between 2 to 5 months of intermittent fasting. A median will be around 3 months. And what that meta-analysis found? It found that alternative day fasting, if you do it for short period, like 1 to 2 months, body weight or body mass index will go down in healthy individuals and in adults with overweight, obesity, or non-alcoholic fatty liver disease in comparison to regular diet. And this got the highest evidence. But if you also do alternative day fasting for 2 to 3 months or 2 to 6 months, and you will look to the benefit, again, you will see reduction in body weight as you can see. So body weight definitely is going down with this type of fasting. Now, if you do it for 2 to 6 months, there is also reduction in fat-free mass and also reduction in fat mass. Even fat mass goes down with a very short period of fasting. And again, all of those get a moderate grading in the evidence. 5-2 fasting, if you do it for 3 to 6 months, you will find improvement in insulin sensitivity and reduction in insulin level, and especially if this is done in overweight and obese population in comparison to continuous calorie restrictions. So the key finding from this huge meta-analysis is that alternative day fasting and 5-2 fasting are the only 2 types of fasting that have impact on body weight, BMI, fat mass. But again, there are many things that need to be studied. We need to know what is the impact in younger population, in elderly population, on a longer time. What is the safety and efficacy? What are the impact on different kind of population, especially population with health conditions like diabetes and other chronic problems. So now let us take a closer look in each type of fasting. So alternative day fasting. And one of the ideal studies that had been done was a randomized clinical trial among 100 individuals. All are obese. And the study was prolonged for a whole 1 year. So you see now, if someone will do alternative day fasting, in the fasting day, they will have 25% of the calories. In the non-fasting day, they will eat 125% of the calories. And in comparison to 2 groups, one group restricted calories to 75 and a control group which eat in the normal way. So what the study found was very interesting. Whether you have an alternative day fasting or calorie restriction, the weight loss is exactly the same in comparison, of course, to the control group, which means that there is no additional benefit that you will get from alternative day fasting in comparison to caloric restriction. They also found that the alternative day fasting group ate more than what people told them to do in the fasting days and less in the non-fasting days, which is very, very interesting human behavior when you give them this type of fasting. And also the adherence was much poor with the alternative day fasting. So this is, again, a payoff. So people lose weight, fat mass will go down, not better than caloric restriction, but the adherence was a little bit more difficult. Of course, if you will alternate and you will eat only 25% of the calories, that's not acceptable for longer duration. So what about 5-2 fasting? So here is another well-designed clinical trial among 107 people who are obese and overweight, women aged between 30 and 45. And then they give them 5-2 fasting, again, 25% in the fasting days and 100% in the non-fasting days, and then caloric restriction lower than 75. And they asked them to follow a Mediterranean diet, which is a healthy diet. What they found, actually, no big difference. Both of them have exactly the same effect, an improvement on fasting insulin, insulin resistance, leptin adiponectin ratio, any factor that they measured, they found no difference between 5-2 fasting and the most interesting that when they asked people, will you willing to continue to do that, they found only 58 accepted to continue on 5-2 fasting, and 85% accepted to continue on caloric restriction. So there is similar benefit, but 5-2 fasting is, again, difficult to adhere to it. So what about time-restricted fasting, time-restricted eating? This is a Ramadan fasting. And this is very important for us to know what is exactly you will expect from prolonged fasting period per day, 12 hours or 16 hours. So here is 19 clinical trials, including around 475. 11 of them are randomized clinical trial, 2 non-randomized clinical trial, and they have mix of population. Some of them are healthy, some are overweight, some are obese, pre-diabetes, metabolic syndrome, non-alcoholic fatty liver disease. You have a heterogeneous number of people, but those are many trials. And the whole idea here is to evaluate what is the impact of time-restricted eating if it is continued for 12 to 20 hours. What's the impact on body weight, body composition, and other metabolic parameters? The study found, which is, as you may expect, some reduction in body weight. And I mentioned there is some reduction. I won't say significant reduction, but some reduction in body weight. What's very interesting, when you have unhealthy population, you will see significant reduction in body weight. In healthy participant, there was not associated with weight reduction. So again, it's very interesting that in unhealthy, you will see the weight reduction, but in healthy, you will not see that weight reduction. Several of those studies found the reduction in percentage body fat and also in total fat mass. And as you here is fat mass and percentage fat mass. So there is definitely reduction in some fat with time-restricted eating. Also, some healthy individuals experience also fat loss, but it is even occurred in people who maintained body weight, which means that this type of fasting, if the weight doesn't change, especially in healthy population, at least the fat mass will go down. But in general, percentage of body fat is going down and total body fat is going down. Apart from that, as I mentioned, there is some improvement in blood pressure, fasting plasma glucose, and some metabolic improvement. But in reality, there is no significant difference with the controlled diet, which is just a caloric restriction. If we go deep in that and look to studies that evaluated 12-12, by the way, 12-12 is the most logic, because this is a circadian pattern. So you are basically respecting the circadian pattern of the body, and people can do the fasting during the night. You don't have to skip too many meals. And this type of fasting can be the easiest one that people can do if they would like to do time restricted fasting. 16-8, which means that window of eating is 8 hours and window of fasting is 16 hours, similar to Ramadan fasting, had been evaluated. Again, here is another very good study, which is done among 105 people overweight and obese. And they give them time restricted eating, where they eat only for 8 hours, or constant meal. So this is not a caloric restriction, just constant meal. What the finding? Well, the finding is actually disappointing. There is no difference. So in relation to weight, anthropometric measurements, metabolic profile, markers, lipid, blood pressure, basically no big difference between them. Problem that with time restricted eating, there is actually loss in the muscle mass. So appendicular lean mass went down with time restricted eating. So people lost muscle mass. And by the way, loss of the appendicular lean mass is usually associated with poor health, weakness, disability, impaired quality of life. So this is leading us to a summary that I would like to leave you with, that Ramadan fasting is basically a time-restricted eating, which is one of the 3 models of intermittent fasting. Time-restricted eating, like Ramadan fasting, reduce body weight, reduce fat mass, and even if it doesn't reduce body weight, it reduces fat mass in healthy individuals, and it improves blood pressure, but it reduces muscle mass. And this is actually alarming for us, that when we tell people who are fasting Ramadan to follow a diet plan, we need to increase their protein intake and advise them to do more strength exercise so they get the maximum benefit. So they get less fat mass, some improvement in blood pressure, some improvement in some metabolic parameters, but without loss of the muscle mass. Alternative day fasting, as I mentioned, reduce body weight, fat mass, improve lipid profile, but it's very difficult for people to follow for very long time. And as you had seen, compliance was poor for longer duration. 5-2 fasting, reduce body weight, improve insulin sensitivity. But its effect is not different from continuous caloric restriction. So if people would like to have an alternative way, they can be on continuous caloric restriction, or they can do the 5-2 fasting. And as I mentioned, less people are willing to continue. Still, we need more studies to evaluate the benefit of long-term adherence to each pattern of intermittent fasting. So it is trendy. People are doing it more. Of course, we have been doing fasting Ramadan for a long time. There is some benefit, but the benefit has some also drawbacks that we have to pay attention to, and also to understand exactly what to expect from fasting, either by time-restricted eating or by other types of intermittent fasting. With this, I hope I give you a lot of fuel for thoughts, and think of that, and we can discuss more in the discussion section. Thank you so much.